good evening, good evening, and welcome to Wellness Watch, presented by the African American Wellness Project. I am your co-host, Ellis Dean, and we have a wonderful program for you tonight. We've got a full program, so we're really excited about what we have to discuss with you tonight. So real quick, while we're getting started, I want you to drop where you're watching us from in the chat room. So we'd like to know where you're watching from all over the world, all over the nation. We'd like to see where our people are watching from. So make sure you put that in the chat room and we'll give you a quick shout out. Also, I want to say, make sure you share the show with your friends. If you are getting some information that you can use, that means somebody you know can use it too. So make sure you share this program with your friends and family. Tonight, we're going to be talking about women's health. We've got two wonderful guests that are going to come in and talk about women's health, maternity health. We've got an OBGYN that's going to be coming in. So please stick forward with that. Of course, we kind of give our updates. Shout out Emily, Houston, Texas. So we've got a COVID update. And then at the end of the program, Dr. LeNoir and I are going to talk about the effects of racism on our health. And so we know that racism is a stressor for many Black and brown people, many people of color around the nation. But we're going to give you some great facts about how it's affecting your health and what we can do to overcome the effects of racism on our health. So that's what we have on stock for you tonight. So sit back, we're going to make it an informational as well as entertaining show tonight. But we can't be entertaining and informational without the man of the hour, and that is our Dr. Michael LeNoir. How are you doing this evening, Dr. LeNoir?
I'm doing well, but I'm still trying to understand why I'm not the man of the day or the man of the week.
It's an hour.
What do I have
an hour?
No, we have a very serious program tonight because it's pretty clear from the issues around the George Floyd situation that we as African Americans are anxious and concerned. Here's a clear murder filmed over 10 minutes, and yet we are anxious and nervous about a verdict. And I think what most of us don't understand is that this constant state of anxiety that we're in for a number of reasons has a tremendous impact on your health, and we're going to discuss that. One of the issues that has stood out over the last several years, obviously several months, is the issue of the impact of the COVID epidemic on the African American population. And we know there are a number of reasons for that. Obviously, I'm the one that pushes that we were the early first responders without knowing about the pandemic. But more than that, it revealed a sore spot in America, that we as African Americans, as a group, are so much less healthy than the rest of America. And a virus like this feeds off of that. And that's one of the reasons our death rates are twice as high. And we have to explain to America why our vaccination rates are probably twice as low. But we'll have an opportunity to discuss that more toward the end of the program. And I think that when we talk about the COVID vaccination issue, we're really talking about the J&J issue about the committee trying to decide whether or not to release it, worried about the thrombosis that have occurred in 6 out of 7 million people. I think at the end of the week, we'll find out they're going to release this vaccine. A one-shot vaccine with the risk versus benefit, I think is so important to so many of our at-risk populations that I'm pretty sure that they will release it. They've already done it in Europe. I'm sure they'll do it here. What's so discouraging, though, is that while we're twice as many deaths, and the percentage-wise, we're still only 9% of the vaccinations that have been given. And we need to all work to change that. I think now we've got enough information now. I mean, there was a time when we said, well, let's be patient about the wait and see attitude.
And that 9% you're talking about, Doc, is for Black Americans, right?
For Black Americans, yes. But we were very tolerant. I mean, we said, look, let's wait and see. We understand. I don't understand anymore. With all of the information that's out there, with all of the medical implications of you not being vaccinated, but not just you, but for you and your family. And with all the implications about the fact that your life will change dramatically if you're not vaccinated. You're already seeing that. People want to see if you're vaccinated to get into religious services, to get into theaters, to get into sporting events, to get on a plane. And so consequently, you have several things to start to think about. And it may ultimately affect the kind of jobs you can get if you're not vaccinated. That may not be the primary reason, but the reason I'm talking about is that all the research that we've had, all the experience with 24 million people completely vaccinated, 40 million people with one shot, we really need to start to think more creatively about how we get our population. One of the shocking statistics, Ellis, that got me was that 65% of older Americans have been vaccinated.
Yes.
If you're an older American, I like to use the term elderly. I don't like the term older.
Seasoned. That's what mom would say. Seasoned.
Seasoned. I really like that. Spicy and seasoned. But with seasoned Americans, only 65% have gotten that vaccine. For me, I really don't understand that part of it. But in any event, let's move on to the first part of our discussion.
Well, I will say that in response to that, remember they rolled it out in tiers, and that older Americans were the first group to be vaccinated, and so it only would support the fact that they are the highest group. Now, what also is that the younger generation with their let's say the underdeveloped frontal lobe has affected their reason and judgment when it comes to getting all the information, getting the facts, and putting the facts in a situation that makes sense. And so there has been an effort, governmental as well as local and community effort, to try to educate the younger generations to get them more. And what I mean by younger is those that are the vaccine age 16 to about 35 seem to be the most, in terms of age group, hesitant to getting the vaccine. They feel like even if they get COVID, they'll survive, and so therefore they're not really as moving towards getting vaccinated. And so we have to be more cognizant and address the issues that they have, because they're using social media as their primary source of income, of information, and that may or may not be the best place to get it.
Well, the African American Wellness Project is in all those spaces, and I would say that most of the serious the increase in coronavirus infections is in that age group now. So consequently, if you want to play sports, if you want to go to venues, you have to start to think more strategically. One of the things, and this will be my final word on this, is we're able to get away with that discussion with the routine 14 or 15 vaccines that are available. We still lag behind in that immunization piece. But one of the things about this virus, it's not planned. There's no herd immunity. There's no way for you to kind of roam around and have everybody else being vaccinated. So it's very dangerous. And we'll continue to have this discussion.
Absolutely.
But at this point, it's just my pleasure to introduce one of my colleagues, and certainly one of the people I have the most respect for, Dr. Kevin Smith. Dr. Smith is the chief of obstetrics and gynecology at the Alameda County Medical Center. It is a medical center with 5 hospitals, 4 wellness clinics, 1,000 physicians. And so it's really one of those large urban medical centers. Now, what's not known about Dr. Smith is that he left a very practice. His practice, he practiced here in the Bay Area, had one of those upscale practices where it was like 3 or 4 months to get into. And he left and he went to Howard University to take over as the chief of gynecology and the chief of the obstetrical service there. And he did that because he wanted to make a bigger impact. And I don't know many people who do that. Then he drifted back into the private sector. He was one of the most successful non-invasive surgeon gynecologic service for Kaiser Hospital. And then he accepted a job at the Alameda County Medical Center, which is one of the most challenging jobs, certainly in the state of California and probably in our country. So first of all, I'd like to ask you, Dr. Smith, why did you leave the private, comfortable, the upscale practice of obstetrics and gynecology to come back into the public sector?
I want to thank you for having me on, Dr. LeNoir. I am a huge fan, as you know, and I'm happy to spend any space with you. And Brother Dean, I appreciate you too, and I appreciate what you're doing with this show. It's an interesting narrative that you're spinning there, but I will say I am a safety net doctor, and there's just no getting around that. I, like most African-American people who go into medicine and many others, go into it with a focus in mind about what my purpose is, what I should be doing with a career in medicine. And as you both alluded to in the opening here, it's pretty clear now that it is racism, not one's race, that is the healthcare crisis. And as that becomes ever more recognized, I am very interested in helping to work to mitigate those kinds of that impact on our healthcare. I do want to add that it was Dr. LeNoir who called me and said, "Hey, Kevin, they're looking for a chair over at Alameda Health System." So you forgot that part of the story.
No, well, I appreciate.
Well, thank you for the opportunity to serve in this safety net.
No, we really appreciate.
Yes, we do.
You're being willing to put yourself in that position. You know, one of the biggest crises that has happened in the obstetrical gynecologic community for many times, for many years, is the increased mortality rates for African American women who are pregnant in the prenatal space. Tell us a little bit about that crisis, and we'll talk about what you as a clinician and what your associates, Ms. Moran, have been doing to mitigate against some of these issues. Describe what happened in that space so that our audience can understand, because many of them don't know about this.
Well, you know, it's interesting. I've been describing it as the pandemic before the pandemic. We had a national pandemic before this global one, which is from about 2016 to now. It's been clear that maternal deaths were rising in this country, though decreasing in other countries. And in that setting, Black women and birthing people were experiencing deaths from maternal outcomes and severe complications. Well, deaths at about 3 to 4 times more than their white counterparts, and more complications, severe maternal morbidity as well. There are lots of efforts ongoing. You will hear from one of our fantastic midwives who's helping to spearhead that later in this broadcast. But I think immediately, Dr. LeNoir, it's about, as you just said, making people aware that this is even an issue, empowering Black pregnant people and about this risk, and creating self-advocacy stances for Black pregnant populations, implementing safeguards within our own medical system, creating forums for teaching anti-obstetric racism techniques and culture.
What took them so long, Kevin, to figure this out? I mean, obviously this has been going on. It's just like very much like police brutality in some ways. This has been going on for years and years. What took them so long to figure this out, and what was the primary cause?
So I think you make a great analogy. Is it true that we didn't figure it out, or is it true that we weren't taking it seriously? Is it, you brought up police brutality. We've seen cases like George Floyd for so long that we weren't sure, even with 9 minutes of a knee on your neck, that this verdict was going to go the way it went. It's not a matter of is it figured out. It's a matter of reckoning with racism, and that's been emerging. And we're all hoping that that Black Lives Matters isn't just a moment, and there's not an expiration date on that, but that it really is an awareness that creates a change in culture, and not just a movement.
I'm going to push you a little bit. Did you realize as a resident, as a fellow in non-invasive gynecology, did you realize that this was going on? Did you talk about it during your training? It hasn't been that long. Did this slip up on the African American obstetrical and gynecologic community?
It's really, really a good question. I will be honest with you. When I trained, for instance, in minimally invasive gynecologic surgery, my training, the data suggested that it was less likely for women of color, Black women, to have endometriosis. And that pelvic pain associated with, for Black women, was more likely to be a PID, a sexually transmitted infection. And that if you were a white woman with private insurance, you were more likely to have an endometriosis diagnosis. And this was literally what was taught in medical school. It's true, as we have evolved, and the data has not borne this out. We now know that for Black women with higher education, higher degrees of secondary degrees of education, and higher socioeconomic status, they are still more likely to have poor maternal outcomes and higher risk of maternal death than white women without high school diplomas. So what's bearing out is the data. The data says, well, what is it? What's the difference here? Race.
Well, yeah, I think that's really an important distinction to make. I think too often when African Americans seem to have higher rates of chronic disease, it's always talked about as genetic, and I think that more and more the studies are demonstrating that if African Americans and white Americans get the same treatment at the same stage, the outcomes are the same and sometimes even better. Well, one of the things, so if in fact this is a recognition problem, a conceptual problem, an unconscious bias problem, what you have to change first? You have to change the process, or you have to change the attitudes?
Well, I don't think that a goal should be to focus on the attitude. I think that would be a great advantage. That would be a great plus if we could somehow shift mindset such that racism slowly dissipates. I think if that happens, it would be who knows when, not in my lifetime. And it's not as important as safeguarding against racist behavior. So for me, an awareness around racist behavior is more important, and mitigating against that is more important than avoiding racism. I tell the folks in my department all the time that racism is another vital sign that we have to check for. We have to monitor our outcomes. We have to be accountable for those straying from the norm, those displaying disparities. I think it would be great to focus on attitude, and I'm not trying to dismiss my interest in educating myself and others around me about this well-known crisis now of racism as a health crisis, and the need to uncover implicit bias. But what's more urgent is to mitigate against racist behavior.
So got a quick question. We got some questions from our comment section, so I want to make sure we get these asked of you, Dr. Smith, if we could. We have a question here from Sherry Dampier, and she says, what are the most important gynecological exams for Black women from the age 50 plus? So now we're looking at somebody that might be beyond their childbearing years, but what are some of the most important gynecological exams they should be having?
It's a very important question, and I'm glad you mentioned childbearing. There is a misconception that after you have, after childbearing intentions, if you've decided you've had all your children, that you don't need to see a gynecologist. It's not true. You need a pelvic exam every year. That pelvic exam would help rule out things that are more likely to occur at age 50 or up, like an ovarian mass, or the growth of a uterine mass. And that's not going to necessarily be picked up by you. It would be picked up by a gynecologist like myself, who would do a pelvic exam and find out. The pap smear is another screening that still needs to occur at age 50, which is a test that checks for cervical cancer, a very preventable, early detectable disease. So what becomes confusing is we've figured out now that pap smears, depending on your prior health status, don't really need to happen at an interval sooner than 3 to 5 years, which doesn't mean you don't see your gynecologist in that interval. You still see me every year for that pelvic exam to rule out things other than cervical cancer. But that particular test you won't need to do as often. You also want to get a mammogram.
All right, I want to go back to this issue of how we deal with this whole template of increased Black mortality. You said something that I want our audience to remember, that an African-American woman, regardless of socioeconomic status, has increased morbidity and mortality over any woman with any other kind of degree. And to me, that's a stunning figure, but not surprising. But you have, at the Alameda County Medical Center, taken this on in a fundamentally different way. There have been some legislation, SB 464, and you have responded to that in certain ways. And how have you responded to that? And maybe this is the time for Ms. Wren to get involved in our discussion.
Thank you. So California, recognizing the statistics that you just talked about, Dr. LeNoir, these disparities in outcomes for Black women going through the birthing process, have mandated, and here's where I'm telling you, it's about mandating the behavior. What are we going to do? No matter what you think, this is what you're going to do to help meet this need. That anyone providing perinatal care have implicit bias training that is evidence-based, and that a refresher happen every 2 years thereafter. So this isn't a box checking measure. This is a behavior mitigating law. It is a law. And so
expand on that term, unconscious bias or bias training. What does that mean to our audience?
It's a really good question. I think it's controversial now, actually, what implicit bias really stands for. But I will tell you, for us, we at Alameda Health System have adopted the diversity science training module, which means that perinatal care providers, and likely in our institution others, since it's so broad, anyone could really touch a pregnant patient. It could be radiology. She may be getting an x-ray. It could be the lab. She may be getting a blood test. It could be, so it's really hard to say who is that group that really should know this. I'm hoping to have it be as broad as possible. But we are doing training in a electronic learning manner that is designed by diversity science, evidence-based, and specifically responsive to this SB 464 law that will help describe the risks and how we impose them for brown women and Black women who are in the birthing population.
Now, and it couldn't just be structural obstetric and gynecologic signs and symptoms. It must be much more than just that kind of recognition process. You also have something called a Black centering process, and maybe you can describe this, or maybe that's a spot for Ms. Wren to discuss.
This is definitely a spot for Ms. Wren to discuss. I am incredibly humbled and proud to work with Jaisha Wren, who's one of our midwives, one of our Black midwives here, who is taking on this healthcare crisis head on. I will let her explain to you what centering is and what we've done to adapt it to the crisis. But she's been with us here for 5 years, before that in the San Francisco area, and has just been I like to call her a force of nature with this effort to support Black birthing population. So I could go on, but I'm gonna let you take this one.
I'm not gonna let you go on. We're gonna go. Ms. Wren, thank you for joining us. As a nurse practitioner, tell us how you got involved in the process.
She's a certified nurse midwife.
And what you have done at the Alameda County Medical Center to deal with this issue.
Yeah, thank you for having me, Dr. LeNoir. Thank you for the introduction, Kevin. So, yeah, like you talked about, this crisis, I just want to stress, this crisis has been going on, has been known about since statistics have been tracked in maternal morbidity, mortality, rates of complications. It has been clear that Black women and birthing people are experiencing complications at way higher rates, with maternal mortality at 3 to 4 times the rate, infant mortality at twice the rate. In some places like New York actually has maternal mortality at 12 times the rate for Black women and birthing people. This disparity, while known of for so many years, there has not been really effective solutions developed and implemented or scaled up. There have been successful models, smaller scale, by midwives, particularly Black midwives, have shown success in moving the needle on some of these health outcomes, but there have not been large scale solutions implemented. And so thus we keep seeing these same statistics over and over again. And that's really what motivated me to become a midwife. I come from a sociology background. So I was studying basically the impacts of racism on our lives. And that's when I discovered the health impacts, just how harmful racism is to our health, and especially to our maternal and infant health outcomes in the country. And so it became my mission to become a midwife so that I could improve birth outcomes for all people, but particularly for Black people, as a Black woman myself. And so I, along with a team of Allegheny Health System clinicians and our public health department, have developed what we're calling Beloved Birth Black Centering. And it really is a program that encompasses all of the things that have been shown to improve the health outcomes for Black birthing people and put it into one full package of Black love. With the aim of really, using the big guns, right? We want to do everything we can because we know that the crisis is huge and it's going to take all the different types of interventions we know of to really affect and reverse the course of these statistics. So I can tell you about the centering group care model. We could start there and then tell you a little more detail about what's different about our model.
No, please go ahead.
So group prenatal care is something that's been around for many, many years. Centering pregnancy is one model of group care. It was developed by a midwife, and the Centering Healthcare Institute is the national body that certifies and trains people to do this group model. And basically what it is instead of the more traditional medical model of prenatal care where you come in, just you and a doctor or midwife, and you have a short visit individually. Instead, at the beginning of pregnancy, in centering pregnancy, you're paired with a group of other pregnant people who are around the same gestational age as you, so around the same due date. And your visits are done as a group together in 2-hour fun interactive sessions where you are really getting to explore the different topics that come up in pregnancy and for birth and for postpartum. And you're getting to have that village of support, that community of support with those other people in the group, about 8 to 12 people. And it's really an amazing model of care. It's done all over the country, and it's been shown to be really effective at improving not only patient experience of prenatal care, it's a lot more fun, you end up feeling a lot more prepared, getting a lot more out of it, but also improves our health outcomes. So literally lowers a person's risk of preterm birth, of low birth weight, meaning a baby born too soon or too small, improves success with breastfeeding, and of course, just satisfaction, so many other things. It's a model really based on empowerment. And so the interesting thing about centering is actually that increase in healthy term babies is actually even greater when you aggregate that data out for Black folks. So for us, it's even more effective at improving those specific outcomes that we are more at risk for because of racism. And so that's why we have chosen this model of care specifically as the foundation of our program to reduce racism-based disparities.
All right, so I think one of the things that you always want to know in situations like this is, have you seen a difference not only in the mortality rates, but also in the around the issue of healthy babies?
Yeah.
And do these groups stay together after the baby's born?
That's a great question. They really want to. Yes, they love their group mates. They really want to stay together. Our program just launched October of 2020. And so we are brand new in terms of our personal data for our program. You know, that data I told you about, there's a big body of research showing the effectiveness of centering pregnancy. We think our model is going to be even more effective at improving health outcomes because we're taking it a step further. We are literally thinking about what are all the different ways that racism impacts our bodies, our lives, our physiology, and we're building in a lot of extra components into the program, things like nutrition. So we are providing, healthy produce delivered to our participants' home. We're providing 6 weeks of restaurant-prepared meals postpartum. We're providing a whole different kind of childbirth education that's Black-centric, that's anti-racist, that talks about just what you said, Dr. LeNoir, of the fact that it's not race that's causing the complications, it's racism. How does it impact our health and what we can do about it? So we know that adding those extra components is only going to increase the effectiveness of our model. And so we will be able to give you more statistics as we finish more cohorts. Right now, our first Black centering group is almost done. They have 2 more sessions left out of the 15. And they are really, they have a lot to say about their experience. So what we know already is that their experience is completely different. And it is where people are using words like life-changing, transformational, life-saving. So it's really, it's been gone beyond our wildest expectations, honestly, about what an impact a program like this could have. It's an all-Black care team caring for all Black participants, specifically from an anti-racist perspective and from an empowerment perspective. And so we have, wonderful patient stories that your listeners can look to understand what is this like to receive care in this way, and what does this really mean for a Black woman birthing person, especially in the year we've had, especially with cases like all of the murders we've seen of Black people. Our participants are carrying Black children. And when we think about the weathering, when we think about the chronic stress of racism and what that's like to not only experience it yourself personally, but then worry about the child that you're carrying. And is his or her life going to matter in the country you're in? A lot of stress. And our participants spoke about that stress at a recent watch party we had for Black Maternal Health Week. And
so I know we only have you for a short amount of time, so I'm going to get some of the questions, some of the audience questions here. One of the big questions, Dr. Smith, is that there's some concerns about the vaccine and the effect it may have on somebody that is in childbearing years, may want to have children. Will the vaccine affect their ability to have children? Does it affect the DNA? Can you kind of touch on that a little bit for our viewers so they know that, okay, if I get vaccinated, will I be able to have children? That's a short question.
Right. So I just have to, I want to, if you will allow me, just add one piece to Dr. LeNoir's previous question, and that is, this is brand new. Black centering is new. The concept of centering and its likelihood to help mitigate against preterm and low birth weight rates being attached to those who are most likely to get it, like an all Black cohort, is brand new. Yes, we are eagerly looking to see what our data shows and very excited about what to anticipate. And Ellis, to answer your question, there was some myth somewhere that if you were, that the vaccine would affect your ability to get pregnant if you took it as a woman of reproductive age. It's not true. There's no data that bears that out, and the vaccine is encouraged.
And I have one final question for the two of you, and I'm keeping it real. I
Keep it
don't
real.
know how in California you got an all-Black program together. And let me tell you what one of my pet peeves is, and it's certainly not a racist approach to anything. Whenever there are programs in California, there are language-based programs for Asian populations, there are Spanish-based programs for Latino and Latinx populations. But African Americans always have to be multicultural. Every program that I've seen we have to be multicultural. How are you able to structure a program that is unique to Black women?
that's a good question. Do you want to take that, Dr. Smith?
Well, I will say, Dr. LeNoir, it didn't happen overnight. And it didn't happen without a lot of might. And it didn't happen without most of that coming from Jaisha Wren. But there is something about the timing the Black Lives Matters piece, the climate reckoning with racism, the pronouncement by every major medical governing body that racism, not race, is a healthcare crisis. So it made for easier opened doors ultimately, but it was not without a bit of a battle.
Well,
Taisha, would you chime in? Yeah.
I think that was a great way to put it. Yeah, I think the national moment that we've had this year has really helped to pave the way for more bold anti-racist initiatives like ours.
well, I want to read one comment from Sheila McLean that says that this is why it's important for us as African Americans to be educated about their bodies and health and not to be intimidated. Also, stay in touch with family members of all backgrounds, get to know them, ask them, how is your health? Are you staying on top of your annuals? Find the resources that are available for them. And this is one of the things that we talk about almost continuously with the African American Wellness Project. And those of you who want more information on how you can be more effective in that space, please go to our website at aidwellnessproject.org. And thank you, Dr. Smith, and thank you, Ms. Wren, for joining us and sharing this with us. We're going to bring you back and ask you some real questions about the success of your program.
Yes, please do. We'd love to share.
Yeah, we couldn't be more excited about what's happening here. We are changing the game with Taisha's leadership on Black prenatal care.
All right. Well, thank you very much. It's good to see it happen at one of the largest, most successful public medical centers in the country. And thank you, Dr. Smith, for coming back. All right. We want to stop now and thank them for joining us. And we want to talk a little bit now, Mr. Dean, about the whole issue of racism in health. You know, what bothers me most about this whole last week, in the last couple of weeks, is that we as African Americans have been so anxious about the verdict that looked so conclusive in any other circumstance that clearly it has affected all of us. And when you throw that in the mix with our statistics around coronavirus, I would have to say that this is a time and a place to start to talk about the impact of racism on the health of African Americans. I think that there was a 60-minute interview with Dr. Williams, who's a researcher at Harvard University, who's been looking at this for almost 20 years. But I still think most of us who go through our lives day to day don't understand the subconscious issue and the pressure that racism puts on us.
Yeah, you know, I think I don't think the racism is just limited to Black people and the effects it has on health, right? And so, and you know how I feel about this. I think that racism affects majority or white culture just as much as it affects Black people, because it affects it in a different way. It affects majority culture in a different way. But I do think racism has an effect on them as well in terms of feelings of guilt, anxiety, frustration, anger, all of those things build up. And just like the stress that we have in terms of if the police officer gets behind us, if we're walking in the store and they're following us around the store, if we're not recognized, all the microaggressions that we go through at work, whatever we encounter on a daily basis in terms of racism and those stressors and the impact it has on our health, I think on the other side there's another side of that coin, and there's just as much effect on the majority population. The reason why I bring that up is like, okay, we're on Blackdoctororg. We should be talking about how it affects Black people. The reason why I bring that up is because if we talk about Black people exclusively with regards to trying to overcome racism and its effect on health outcomes, as you can see from just our previous guests, there's not a lot of care when it comes to just Black lives being affected. We saw what happened. We saw what happened in Minnesota, and we saw the video, and we were still waiting yesterday with our breath held because we didn't know how the verdict was going to be. So if we're just talking about racism in terms of its effect on Black people, majority culture is not going to care. We have to talk about it in terms of how it's affecting all of cultures, both cultures, all of the cultures in America, and in order to say this is a crisis that is affecting all people in different ways.
Yeah, you're talking about the solution to the problem,
Yeah.
which has to include everybody in the society, and everybody has to buy into the fact that this kind of racism has an impact on the whole society. I think one of the things that most African Americans don't realize, because we get used to it, it's almost like seeing police brutality. It's almost like a kind of a regular thing, and we're not as shocked by it as we should be. But if you look at some of the studies that I've seen recently, the drip, drip, drip of racism has a number of pathophysiologic outcomes on African Americans. If you look at something called weathering, that means how long do we live and how well do we live? You
Yes.
can demonstrate that for African Americans, we're weathering 6.1 years faster than anybody else in the society. There have also been some studies that looked at the whole issue of what happens with this drip, drip, drip of racism. It increases the production of certain hormones. Those hormones lead to problems like hypertension, diabetes, high cholesterol, stress and anxiety that wears on us in unconscious ways, in ways in which we don't know. If you look at zip, and it's not just about poverty. I mean, I think it's much more than that, because if you look at the issue around, we just talked about, around mortality for Black women, and you say something like Black women who are educated have increased mortalities over white women who have high school educations, it demonstrates that something is wrong in the whole process, and that we're not recognizing the things that we need to do in order to stay healthy. If you look in Oakland, the zip code, from one zip code to the next, up in the hills as opposed to down in the lower parts of Oakland, the life expectancy of a Black man is 6 years less than for any other male in Oakland. And so consequently, we're really gonna have to start to really think about how we, as you know, the philosophy we've had at the African American Wellness Project is that these things are not gonna be solved from the top down. They have to be solved from the bottom up. And African Americans have to understand that you're being affected. You're being affected by the fact that there are not grocery stores in your neighborhood. There are not places to run and exercise. There was a study done by Dr. Williams where he had an index that showed that if you're an African American, your attitude, someone is killed in your neighborhood who's unarmed, it affects the mentality of the whole neighborhood for over 3 months. And he's got an index and shows that. And so I think we really need to discuss this in a little bit more general fashion, that we as Black people on a day-to-day basis are being subjected to the kinds of pressures that lead to some of the poor outcomes we have. And so
I think we have to recognize that Black people suffer from a collective PTSD with regards to our experience in America. And for those that may or may not know, PTSD stands for post-traumatic stress disorder. And that and everything that we see, the George Floyd, the other young brother that got killed in Minnesota, I can't recall his name right now, that got killed for the air freshener or for the expired tag or whatever, the Breonna Taylors, the Sandra Blands. Every time one of those things happens, it is a trigger for our PTSD that we have suffered in terms of long-term trauma in America. And so we do have to recognize that, but we also have to recognize that there are ways that we can mitigate in terms of that life expectancy gap. Dr. Smith kind of talked about it a little bit in terms of getting rid of some of the bias that is already inherent in the medical profession. There's a bias that I've researched on my own that said that there was a belief that Black people in general, but Black women specifically, had a higher pain tolerance. And so therefore, when we're talking about infant mortality and things like that, Black women may come in experiencing some pain with regards to their pregnancy, and bias says, oh, it's not that big of a deal. she's just complaining, and they could send her home or prescribe her less effective medications that could lead to complications later on in pregnancy if they didn't take it seriously. And so we have to recognize that those biases and racism in general do affect our life expectancy. And if we can recognize that, and we've talked about that on this show and on other shows that we've had about being your own best advocate with regards to the healthcare system, we have to recognize, okay, you have to know your family history in terms of health conditions. You have to know what foods you should be eating and could be eating, and are there healthy alternatives. We also have to recognize that society has food deserts, and a lot of times practices like redlining have kept Black people into communities that don't have the same access to those are the social determinants of health. All of those things are factors in terms of creating that life expectancy gap that you just mentioned. And what we have to do in terms of Black people is we've got to take charge of our own health and say, hey, look, we're going to respect and understand how we work and be better advocates for ourselves and for our community.
You don't expect the system to change. I mean, we're hot right now. I mean, the George Floyd thing. I mean, obviously, what amazes me is it's surprising to the larger population of white people that we are sicker and have been sicker since what Dr. Hood calls the slave health deficit. We've been sicker for 400 years. And so consequently, when we look at the impact of the coronavirus on the African-American community, it just stunned me that CNN and all these other doctors were surprised about the impact the coronavirus on the African-American community. Black doctors were not surprised. We knew that obviously when America gets a cold, we get pneumonia. And we understood that if you look at anything from the cradle to the grave, in terms of morbidity and mortality, African-Americans suffer greater. What's more important now that I'm seeing in all the research, let's just take prostate cancer, for instance. Prostate cancer is a higher incidence in African Americans. We have more deaths. We have more metastasis. And always it's been said because of a number of reasons. We go late. It's something genetic. It's not genetic. If you look at all the studies that have been done by the VA, where they took African Americans and white Americans, same stage of prostate cancer, same exact treatment, the outcome for the Black Americans were actually slightly better, but certainly they were no worse. And so consequently, this is another issue. Recently in the Journal of the American Medical Association, one of their primary philosophers, I don't know whether it was the editor, and I don't want to be inaccurate about this, said that he did not believe that there was unconscious bias sufficient in medicine to make any changes. When all of us, one of the reasons I started the African American Wellness Project, because I was enraged about how the system treated us differently.
Well, the hard thing about bias, especially unconscious bias, is just that. It's unconscious. You have to make it conscious in order to recognize biases. And so when I was going through diversity training, diversity and inclusion training, that was one of the things that we talked about in terms of when we go into companies or we do one-on-one diversity initiatives, is we've got to help people recognize where their biases lie. And so for him to make that statement, I'm laughing because I find it comical for somebody to say that they don't know that they don't believe there's enough unconscious bias. You haven't even tried to scratch the surface. If you haven't even had these conversations and had somebody adequately talk to you and help you identify where your areas of bias are for you to be able to speak, significantly about bias. And so the other part of bias is we've got unconscious bias, which drives our behaviors. And then those behaviors create another type of bias, which is called confirmation bias. And so what we're doing unconsciously is we're creating a self-fulfilling prophecy. And then we use that data to say, see, this is what we said. So a clear example is policing, right? And criminal records. And they say, oh, Black people commit more crimes, and so therefore that's why we have more police in their neighborhoods. But what they're finding is that the stops, when you look at the police, traffic stops, that Black people were up to 2 and 3 and 4 times more likely to be pulled over, but yet their white counterparts were more likely to have drug contraband found in a car search. So what does that say to you? What that says to us is this: if you pulled over more majority culture, you will find more drug paraphernalia, more contraband. And so therefore the crime statistics will level out to where they really are versus them being a preponderance. But if you're pulling over 80% Black motorists, then of course you're going to find what you're looking for. And that's really the self-fulfilling prophecy that comes with, and you get this confirmation bias. And then those statistics are used against Black people, saying you commit more crimes. When you're
I think that just demonstrates to us, I mean, like I said, the anxiety around this George Floyd murder. I mean, clearly, you can't even have murder in a Western movie more clear than this. And the fact that we were all anxious about what the verdict was going to be, you can't quantitate how much that anxiety affects your health and affects how you see things and how you view things and what your day is like. And that's one of the reasons here, and I'm not pushing this, but the African American Wellness Project provides, I think, a way for you to start to build your own health system so that it is a bulwark, it is a barrier against your being taken advantage of, your being taken for granted. Once you understand the things that you need, and we have a book called Focus on Your Health by Dr. Glenda Newell and Dr. Brenda Spriggs. And if you go to our website or you email us at aawellnessproject@gmail.com, we will send you at least 1 or 2 new copies of the book out each week. But everybody should have this book, because there's no way, from my perspective, in living in this country as long as I have, that the society is going to be able to take care of this problem. This is a problem that you're going to have to take care of for yourself and for your family. And you're going to have to recognize that the day-to-day stuff you go through, every other Black person is going through in one way or the other, and it definitely impacts the long-term implications of your health, which means to me that you have to be better prepared when you go into the healthcare system than anybody else in this country. And so consequently, listening to our programs, we give you information. But what you do with that information, how you construct your own system, I think is the most important thing.
I think it's important, even on our site at Blackdoctor.org, I think we have channels dedicated to a lot of different medical conditions, especially those medical conditions that affect Black people the most. And so if you're uncomfortable in talking to, if you have a medical practitioner, if you're a primary care physician, or if you don't have one, but you want to learn something more about a medical condition, you can go to the site, you can go to African American Wellness Project, you can go to blackdoctor.org and learn about it. So therefore you're fortified when you do go see a doctor and you do have the latest information about a medical health related condition. So therefore you can be your best advocate and don't just rely on that doctor, not hope they don't have bias or hope they are culturally competent, that you come in there and say, no, doc, I read about this medication that seems to be better suited for Black people. So we do have to take an active role in our health decisions and not just rely completely on the advice of doctors that may or may not have our best interest at heart.
And I'm going to use the opportunity, because we're doing a podcast on Blackdoctor.org, to say what was said in that movie. I think it was News, whatever it was. You got to be mad as hell and say, I'm not going to take it anymore. You got to build the kind of construct so that you can go into that system with a certain amount of knowledge and information. And that's what Blackdoctor.org will give you. And that's what we'll give you every week on the Wellness Watch. So I'd like to thank Mrs. Friend and Dr. Smith for joining us and sharing with us something you might not have known about the mortality rates among Black pregnant women. Once again, Mr. Dean, thank you for shepherding us through this whole process. And I'd like to thank those of you taking the time to listen to us. We want you to join us each week. We want you to get in that chat room and challenge us on the notions that we have. And we want you to remember that health is your biggest asset, so protect it.